I like to ask your permission to use this video for educational purpose and on the internet.
Absolutely.
Tell me about, no, you say so absolutely, like, why don't you even hesitate to share your story with other people?
Because you're a wizard. You cured my problem.
So tell me about that problem that we...
For 15 years, I've been in chronic pain, and it got extremely difficult to even function. The last 2 years, I was introduced to you, and here we are, 2 years later, and I feel amazing.
Yeah. Now, describe for people who don't know you what your symptoms were. Where was the pain? How was the pain?
I was in my left side, and I couldn't sleep or sit for any amount of time. The pain was so bad when I would try and lay down and sleep that I was ready to end it. I was like, I can't continue like this. I couldn't sleep at all. I was miserable. My family was miserable.
That made me really sad. You said you were ready to end it. What do you mean by that?
Exactly that. I was like, if I can't sleep and I can't function and I can't be there for my family, what am I doing here? And something needs to change. I was so miserable. The pain was so bad. I thought that removing myself from the situation would be better than the pain I was in.
I'm hoping I'm not the first surgeon you saw or medical personnel you saw. What did my colleague, no name please, no name, but what did we in medical profession, what did we do for you in these 15 years?
The chiropractors I saw did more damage, unfortunately, and I think they were out of their league. They were trying to fix a problem that they weren't equipped to fix. They didn't diagnose it properly, and the chiropractors did more damage. The last time I saw a chiropractor was 2 years ago, and I left feeling worse than I did when I went in. And I said, I can't go there anymore. They were doing adjustments that were making my condition worse. And you fixed my cousin 2 years ago, and I just by chance I happened to be talking to him, and I described to him the pain I was in, and he said, talk to Dr. Abbasi.
Yeah.
I'm
Did you talk to any other surgeon beside me?
No, I was still using a chiropractor to try and fix the problem, and they made it worse. And within a matter of days of that horrible visit, I met my cousin for a family function, and just in a brief conversation, he said, hey, give him a call. And so I came in, and immediately, you gave me the steroid injections. Those were diagnostic mostly, but they immediately solved the pain for several months. And then it was getting to this point of getting the surgery approved.
And if I may, I want to turn around and show what we did.
Yes.
Now, you have something we call sacroiliac disease, where the joint where they connect the spine and the pelvis is in a bad shape, and every human has that, but the only function of that joint is opening up the pelvis when a baby passes through. So in man has no function, even in woman has minimal function. When was the surgery?
September 14th, about 6 weeks ago.
6 weeks ago, we went there and we put this construct in, and I'm going to look at another picture that shows it maybe a little even better. Here, this is what we call trident. Through one incision, we put 3 screws in that make the joint finally stop moving. And how is the pain?
The pain I had before is virtually gone. I can do everything I used to be able to do, no problem. Sleeping was the biggest concern. I can sleep just fine. The only pain I have now is just a little bit of soreness as the surgery site heals. It doesn't concern me at all. I can tell that just knowing my body, knowing what I was like before, after the surgery, the horrible pain is gone.
Now,
virtually gone.
Putting it in perspective, that was a 20-minute procedure, and it was a day surgery. You didn't stay in the hospital or surgery center, right?
I think I was released about less than an hour after I came out.
And that's something that for 15 years is bugging you, and you doubt yourself. You think, what is going on? And we do a 20-minute procedure, and that's gone. This is the knowledge we just gained in the last 10 years, that this joint can be cause of exactly what you described. And in a way, because the expertise for that is not out there, many of patients in your situation go to a spine surgeon. The spine surgeon look at the spine and send them out and say nothing wrong with you. And unfortunately, your situation, living with that for so long, and going almost crazy because nobody can help you, that makes me really sad that situation is more common than people think.
Yeah, and it took a while to eliminate all the other problems and reduce it down to this, and I am 100% convinced that this is what it was. I wear a lift in my shoe to kind of help correct some of the lumbar issues that I have. Since I've done that, I don't have any pain above my waist. It was only in my hip.
Yeah, and they aggravate each other. Spine and the sacroiliac joint problem, they aggravate each other. I'm very happy that you came, and you make my day. We live from stories like yours.
Yes, this is what I was hoping would happen, and you did it. So.
And you said you're going to vote for me.
Yes, vote Abbasi for governor.
Well, thank you so much.
Absolutely.
I appreciate that. Okay, so.